Hi, you guys. Welcome back for our daily practice questions. It is day 54, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, one on one sessions, and more to assist nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 25-year-old female who recently gave birth presents with fatigue, pale skin, and dizziness. Her hemoglobin is 9.3, MCV is 74, ferritin is low, and the total iron binding capacity is elevated. She is breastfeeding and reports heavy menstrual periods. So, what is the most appropriate initial treatment for this patient's iron deficiency anemia? Is it A, initiate oral iron supplements and recommend a high iron diet? B, prescribe erythropoietin injections? C, start vitamin B12 supplements? Or D, refer for blood transfusion? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here, the stem of the question states, what is the most appropriate initial treatment for this patient's IDA, right? So with iron deficiency anemia, we're going to A, initiate those oral iron supplements and recommend a high iron diet, okay? All right, question number two. A 72-year-old male with a history of gastric surgery presents with fatigue, difficulty walking, and tingling in his feet. His lab results show a hemoglobin of 10.2, MCV of 110, and a vitamin B12 level that is low. What is the most appropriate treatment for this patient's vitamin B12 deficiency anemia? Is it A, oral vitamin B12 supplements, B, IM vitamin B12 injections, C, folic acid supplements, or D, iron supplements? Take a moment and tell me what you got. All right, so stemming the question here, what is the most appropriate treatment for this patient's vitamin B12 deficiency anemia? And here, this stem shows you everything you need to know for this question, just like question one. Although there's a lot in the scenarios, it's asking you what is the most appropriate treatment for a patient with vitamin B12 deficiency anemia, right? And again, remember you guys, IM injections of vitamin B12 is that treatment that we go with first line. Once you get things stabilized, you can opt to switch them to oral vitamin B12 supplements. But as we are actively with a low vitamin B12 and they're having side effects, they're having the tingling, the neural deficits, and things of that nature, you want to be sure that you're giving the IM vitamin B12 injections, okay? Do not let that trip you up on boards. And then lastly, question number three. A 42-year-old female with a history of chronic alcohol use presents with fatigue, dizziness, and a red, smooth tongue. Her lab results show a hemoglobin of 8.6, MCV of 105, and low serum folate levels. Vitamin B12 levels are normal. So, what is the most appropriate treatment for this patient's folate deficiency anemia? Is it A, oral folic acid, 0.4 milligrams daily? Is it B, IV iron supplement? C, folate injections? Or D, erythropoietin therapy? Take a moment and tell me what you got, y'all. All right, so stemming the question here, what is the most appropriate treatment for this patient's folate deficiency anemia? Again, it's telling you the diagnosis and asking you specifically in the stem what you need to know. What is the appropriate treatment for this patient with folate deficiency anemia, right? Remember, with folate deficiency anemia, we give oral folic acid 0.4 milligrams daily. A is your best answer. Do not get tripped up with all of the extra things that may look similar. So that's why I tell y'all when you're studying, work through, do your assessment, diagnosis, evaluation, treatment, right? So this for a scenario, all right, the fatigue, the dizziness, the alcohol use, the lab values showing you the MCV of 105, making it macrocytic, the low serum folate levels, that's all the assessment, right? And letting you diagnose and coming up with your differential diagnosis. Because with macrocytic, normal chromic, it can be B12 or folate. But where you saw that it says serum folate levels are low and vitamin B12 are normal, that confirms your differential diagnosis of folate deficiency anemia, right? That's the diagnosis phase. Evaluation, it will be like if they came back and you're deciding on different factors that you may need to do or change or continue or stop, etc., would be your evaluation factors in this scenario. And treatment is knowing that we give oral folic acid 0.4 milligrams daily. And I say this, if you walk yourself through all of those steps, when you get a question on board, you're able to pivot and answer it correctly each time, because no matter how they show you the question, I should say present the question, you will be able to pivot and answer the question. But if you're just generalized studying and only knowing, all right, macrocytic normal chromic, it's folate here, and then nothing else, then they're able to trip you up with questions like this, like folate injections. And then now you're sitting here saying, is it A or is it C? Because you typically get it down to those two. But if you're studying in the way that I teach y'all, assessment, diagnosis, evaluation, and treatment, I guarantee that you will feel more confident when answering your questions, and I guarantee your success. Tell me how it shifts. If you read that stem of the question and you walk through when studying assessment, diagnosis, evaluation, and treatment, watch the difference even in your practice question scores. All right, but that's my rant. But as always, y'all, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if y'all need any other things that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. But as always, if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.